Dr. Khaled Abdel Ghaffar, Deputy Prime Minister and Minister of Health and Population of Egypt, receiving a commendation from Dr. Hanan Balkhy, Regional Director for the Eastern Mediterranean Region, credit who Egypt has become the 26th country to eliminate trachoma as a public health concern, building on a steady string of triumphs over tropical diseases. Having eliminated lymphatic, filariasis, malaria and now trachoma in the last 30 years, Egypt has emerged as a continental leader in the control and eradication of neglected tropical diseases. Trachoma, caused by the bacteria Chlamydia trachomatis, is the world's leading cause of infectious blindness and has been documented in Egypt for over 3,000 years. Public health efforts to address its burden began in the early 20th century, when pioneering ophthalmologist Arthur Ferguson McCallum established Egypt's first mobile and permanent eye hospitals and laid the groundwork for organized trachoma control globally. Yet by the 1960s, it still blinded many adults and affected over half of all children in some Nile Delta communities. Since 2022, the Ministry of Health and Population of Egypt, in partnership with the World Health Organization and other national and international stakeholders, has pursued trachoma elimination through the Hundul-Say strategy, which represents surgery for trichiasis, antibiotics to clear the causative organism, facial cleanliness and environmental improvement. Between 2010 and 2020, extensive mapping and surveillance across all 20 of Egypt's governorates showed steady reductions in the proportion of children aged 19 years affected by active inflammatory trachoma and no significant burden of the blinding complications of trachoma in adults. Both indicators are now below WHO elimination prevalence thresholds nationwide. In 2024, Egypt integrated trachoma surveillance into its national electronic disease reporting system, which should facilitate rapid response to any future cases. Egypt's elimination of trachoma as a public health problem underscores the nation's sustained commitment to equitable healthcare delivery and the transformative impact of initiatives such as Haya Karma, which have expanded access to safe water, sanitation and primary care services in rural communities, said Professor Dr. Khaled Abdel Ghaffar, Deputy Prime Minister and Minister of Health and Population. This achievement is a collective triumph for Egypt's health workers, communities and partners who collaborated to eradicate this ancient disease. Egypt News Grand Egyptian Museum finally opens in sight of the pyramids after decades of setbacks. The country became the seventh in the Eastern Mediterranean region to eliminate trachoma as a public health concern, defined as 1 in 1,000 adults with trichiasis. The region includes the Near and Middle East as far as Pakistan, the Arabian Peninsula and North Africa, including Morocco and Somalia. This milestone adds to Egypt's strong track record in eliminating communicable diseases, including polio, measles, rubella, and most recently malaria. It demonstrates what can be achieved when political commitment, strong partnerships, and years of sustained public health efforts, led by the Ministry of Health and Population, come together towards a shared vision, said Dr. Nima Abid, who represented to Egypt. Egypt's achievement serves as an inspiring example for other countries in the region and beyond. More disease control victories. First African nation to eliminate river blindness, treated millions with ivermectin to achieve great success. Following Egypt's success, trachoma remains a public health problem in 30 countries and is responsible for the blindness or visual impairment of about 1.9 million people. Blindness from trachoma is difficult to reverse. Based on April 2020 data, 123 million people live in trachoma endemic areas and are at risk of trachoma blindness. Yet even devastatingly poor countries such as Togo, Papua New Guinea, and Mauritania can, and in fact already have, achieved what Egypt has.